A $15 item went to $17 for 2 eggs.
Your breakfast may cost you a bit more bacon, and bird flu is to blame.
We have outbreaks in poultry in all 50 states. 16 states have outbreaks in cattle.
California's under a state of emergency, but bird flu isn't the only disease on doctors' radar.
It's a very highly transmittable virus.
Today, we're talking about the outbreaks and what you can do to protect your family.
This is CBS News Bay Area with Elizabeth Cook.
I'm Ann Makovec, and if you've had the sniffles or maybe an upset stomach recently, you are not alone. The flu, RSV, and norovirus all here for the winter. Add to that a bird flu state of emergency, and it's a lot to keep track of, especially with kids going back to school from the holiday break. Today, a doctor's going to let us know what to watch out for. The National Institutes for Health calling for more action to tackle bird flu after dozens of people in the U.S. contracted the virus last year. And while a majority turned out to be mild cases, scientists are concerned about a case in Canada where a teenager did become seriously ill. Then there's a case in Oregon where a house cat died after eating raw pet food contaminated by bird flu. And then down in L.A., their Department of Public Health is now investigating the deaths of 4 more house cats that drank recalled raw milk. Here in California, there have been 37 human cases of bird flu so far, according to the state health department. And while they're stressing that the risk to the public is low, Governor Newsom did declare a state of emergency over the outbreak back in mid-December as a way of trying to increase resources and staffing across the state before things could get bad. The most direct impact for most people might be at the grocery store right now, where bird flu is helping boost the already high price for a carton of eggs. Mackenzie Diaz shows us how it is forcing one restaurant on the Central Coast to make adjustments.
Bon Top's Creole Cafe, a San Luis Obispo breakfast staple for nearly 30 years. Now forced to raise prices because of a nationwide egg shortage.
A $15 item went to $17 for 2 eggs.
Owner Philip Lang tells me the bird flu outbreak has caused the price of eggs to go up.
A couple weeks ago, we were paying $51 for a box of eggs, which is 15 dozen, and that went to $110.
Both those prices are up from just a few years ago.
We used to pay $25 for a box of eggs shortly after the pandemic.
And so you decided to take action, and on the menus you have this attached up here.
A yellow paper on the top of Bon Top's menus alert customers to the $1 increase per egg for certain meals.
And this is the first year for the surcharge?
Yes, I've never done a surcharge before.
He tells me many customers are still ordering eggs.
It didn't really impact our order as much.
Others are opting for something else.
When I saw they had to charge the extra $1 per egg or whatever, I was like, oh, I'll get oatmeal and sausage this time.
Lang tells me as a breakfast restaurant, skyrocketing egg prices are especially difficult.
It's a little daunting going into a slow month, knowing it's going to be slower, and also raising your prices at the same time.
When egg prices come back down to what Lang says is a reasonable price,
we're going to take away the surcharge.
Coming up, what a study from Stanford has to say about the effectiveness of vaccines and why we only get some every other year, some only once. Plus, we're going to ask an infectious disease expert about the spread of the flu. We'll be right back. Vaccine researchers at Stanford think they are beginning to answer a question that has long perplexed the field. Why do some vaccines offer protection for a lifetime while others, like the flu shot, only protect for a few short months? Well, a new paper published today in Nature Immunology suggests that it all might come down to a specific type of blood cell. The researchers found that when those cells are more active, they can help to strengthen the immune response. Scientists want to develop blood tests to determine how long vaccine immunity might last. And ultimately, the hope is that better understanding this process will lead to the creation of new vaccines that produce longer lasting protection. Of course, no matter how good the vaccines get, for them to work, people actually need to get their shots. Separate research is painting a discouraging picture of vaccine uptake. According to a federally backed study, 45% of U.S. adults say they aren't sure if they're going to get a flu shot this season. The numbers for other viruses are even worse. Only 26% say they will definitely get the updated COVID shot, and only 21% of those for whom the RSV vaccine is recommended say they plan to get that shot. Those figures mark a decline from previous years, but as Mandy Gaither reports, there are signs that these viruses right now are spreading rapidly.
It's a new year, but we're starting 2025 with the same old viruses, several now surging across the U.S.
You put together a holiday party that's crowded and people talking loudly at one another with not much ventilation, and that's the ideal setting for spreading the respiratory viruses.
Right now, nationally, CDC surveillance of wastewater shows COVID-19 levels are high. Influenza A and RSV levels are both moderate, and the agency says cases of norovirus, sometimes called the stomach flu or stomach bug, are also surging. Between August 1st and December 11th, there were 36% more norovirus outbreaks reported by states who share data on this virus than in the same period last seasonal year.
Norovirus is the most common cause of gastrointestinal symptoms, nausea, vomiting, diarrhea. It's really kind of a miserable illness.
Dr. Paul Sachs with Brigham and Women's Hospital says norovirus is spread through direct contact with contaminated surfaces and other people's hands. Cleaning things like countertops and washing hands can help stop the spread. That can also help keep respiratory viruses from passing between people. And Sachs says if you're sick, stay home.
Sharing is not always caring, at least when it comes to these viral infections.
All right, joining me now to talk about all of this is UCSF infectious disease expert Dr. Peter Chin Hong. Happy New Year.
Happy New Year, Anne.
Let's start with the bird flu, because that's one that is sort of perplexing a lot of people right now. Do we need to be freaked out about this or not?
No, we don't need to be freaked out. We just have to be vigilant. I think there's some new risk factors like backyard chickens, if people have them. If they look sick, don't handle them without PPE. And of course, people know about raw milk and handling sick or dead animals.
And I mean, all of us saw how things quickly escalated with COVID. And the concern is that if this thing mutates, it could be an issue. I mean, it's not just chicken contact at this point.
Yes, humans are getting infected, and California is kind of the hot spot, mainly in dairy and poultry workers, mainly dairy workers right now. But it is a matter of time before it gets into humans. But with that said, though, we're in a different place from the early days of COVID because we have vaccines, we have a test, and we have 4 flu drugs. So hopefully we can connect the dots and implement all of these technologies for the population.
Okay, it's just something that there would be a plan in place that we could get going a little quicker than we were able to respond to the COVID.
Yes, but again, devil is always in the details, and we need to have hopefully acceptance of all these tools that we have.
Right. Okay. And can we just talk a little more broadly when it comes to, these viruses starting and then mutating? And when it comes to atmospheres like factory farms, how concerned are you about them being a breeding ground for other bizarre things?
Yes. I mean, we focus on bird flu for, infections that you can get from raw, uncooked meat and milk. But there are a whole host of other infections. And you remember the recalls of McDonald's, lettuce being tainted. So there are a whole host of things that make us really think about food safety and really paying attention to not just viruses, but also bacteria that can cause things like bloody diarrhea or fevers and things like that. In terms of mutations, the more transmissions you have of something, the easier it is to get a mutation. That's why we're paying a lot of attention to bird flu right now, because even though it's in cattle, in chickens, there are so many mutations because it's crossed over into mammals and it's still around in wild birds, which there is a pandemic in them right now, crossing over the country. So I think that's why we're kind of looking very carefully at that.
Okay, and if it does end up expanding majorly to humans, again, we do have those tools that you mentioned. So hopefully we're not looking at lockdowns or anything crazy.
No.
But can we talk about the norovirus? Because the name really strikes fear in my heart. Anybody who's had a stomach bug at any given time, yeah, that's something that we're going to want to avoid. Why is that all of a sudden, cropping up so badly?
So there are a few hypotheses. One is that, of course, like with whooping cough or pertussis, strep throat, and a lot of things that was suppressed during the pandemic, as people gathered together, you see more of them. Plus, you have winter time. And the other hypothesis is that there's a new variant or mutation that's kind of early, but it is more this year than in the last 10 to 12 years. So we're watching that carefully as well.
Okay, so somebody ends up with a stomach issue. We all know what that means involving the bathroom. Then, do you need to know, was this food poisoning? Is this norovirus? Should I go to the doctor? Or is this something you just sort of let work its way out?
I think for the most part, you can let it work its way out. I think the main thing, if people have diarrhea combined with vomiting, which is kind of a classic norovirus phenotype, is to stay away from other people in the family. It's extremely infectious. You just need 10 particles to get infected with norovirus, as opposed to thousands with salmonella. And the big thing is you can't wash your hands with or use hand sanitizer. You have to wash your hands with soap and water and wipe down surfaces. The very young and the very old, be very careful in those groups because they can get dehydrated very easily.
Okay, that's interesting. It has to be soap and water. Hand sanitizer is not going to kill that virus.
Yes, it's a very hardy virus, and that's why it's so easy to spread: cruise ships, dorms, etc.
Okay, all right. Anything else? We don't have much time, but anything else you want to say specifically about RSV or the normal flu right now?
Right now, flu is rising very quickly in California. Before and after Christmas, it went up by more than 100%. That's because people traveled and brought it back to California, which was very low before. So just watch out carefully for those symptoms. Early treatment with Tamiflu can help the vulnerable.
Okay, all very good advice, Dr. Peter Chin Hong. We always appreciate your perspective. Thanks for watching. You can always get all the latest headlines and weather over on Pix Plus. And remember to like and click the button on the bottom left of your screen to subscribe for the biggest Bay Area news.